All right, guys, what's poppin'? Spot 105.1. Important information and conversation happening today.
That's right.
Which I'm very excited to have. We have today in the room Roger Milliner, who is the Chief Growth Officer at MetroPlus Health Plan.
That's right.
And we are going to talk about open enrollment and just the climate, by the way, right now of insurance. And also MetroPlus Health wants to ensure New Yorkers are well informed. So we are here to help serve that right now today.
That's right.
What is it that makes MetroPlus special?
We're owned by the New York City Health and Hospital Corporation, which makes us a public benefit organization. We're not for profit. We're not publicly traded. We don't have the same distractions that some other health plans when they have to meet shareholders' demands or, they're worrying about making a certain profit. So being a not-for-profit plan, we're really there for the people. We do a lot of things in the community. We've always been here for people, and we put people before profits at all times.
Mm-hmm. That's why you got those high ratings.
Exactly.
What is the number one thing New Yorkers especially need to know about this climate right now?
There's a lot going on right now. With all the changes going on at the federal level, we're going to see a lot of people across the country, but particularly in New York State, whose health insurance is going to be in jeopardy. So, for example, a lot of people who got insurance through the Affordable Care Act, aka Obamacare, they're going to start seeing things like subsidies that they were used to getting going away. They're going to see
How soon do you expect that?
That started already. As of 11/1, November 1st, anybody who was receiving subsidies to help pay for their health insurance, particularly for the Gold plan, that's going to go away.
Wow.
Okay.
That's so scary.
Yeah.
For some people.
Yeah, absolutely.
So how does MetroPlus fit into this, and and what is the best case scenario for somebody in that situation?
So we're here to educate you. The best thing to do is to come down and see one of the marketing representatives. We're stationed at a lot of the city hospitals all throughout the city. You can call us on our dedicated line to reach somebody. You can actually go to our website and get more information. But we are in the community. We have community offices all throughout the 5 boroughs. So if you want an in-person session, come see us. But you can also reach us through social media, through our website, through calling our dedicated enrollment line as well.
And what types of coverage are we talking about? Like,
all right. So there's a couple things. We're in the middle of open enrollment for a lot of different things. So if you're a city worker right now, it's time for you to consider which health plan you want to switch to or change to. So anybody who works for any of the city agencies, the police department, fire department, corrections, MetroPlus Gold is an option. I know a lot of people have been used to, just not making any changes, staying with their plan. But MetroPlus Gold offers a lot of good benefits. So, for example, we have 100
I love that you have it laid out.
It's all laid out. If you are somebody who's on any type of high blood pressure medication, cholesterol medication, you're on contraceptives, you like those GLP-1s for weight loss, we offer 100 free drugs. We offer people gym reimbursement. So if you are somebody who takes advantage of the gym and you're paying a membership fee on a monthly basis, MetroPlus will give you $500 a year towards your gym reimbursement. We'll also give $500 to your spouse and $400 for your children. So that's a value of $1,400 a year just in gym reimbursement.
Wow.
If you're somebody who doesn't like to go to the gym physically and you take advantage of wellness apps like Peloton or Noom or City Bike, we'll give you $300 a year towards your City Bike membership or your Peloton or your Zoom.
Yeah.
If you're somebody who's into like taking steps or drinking a lot of water, we have a rewards program where we give you money for wellness activities. So there's a lot of ways in which we reimburse people for things that they're spending money out for right now.
Yeah. How does it differ from like, I don't know, how does MetroPlus, especially as New Yorkers are concerned?
Sure.
How does it differ from like some of the other plans? Yeah.
One of the things that makes us different than any other health plan is our big network. We have over 34,000 providers all throughout the 5 boroughs.
Wow.
So besides all of the city hospitals, which is Bellevue, Kings County, Woodhull, Queens Hospital, Elmhurst, we also have a lot of private hospitals like NYU, Mount Sinai, Bronx, Lebanon, many, City MD.
That's
so there's
impressive.
a lot of choices.
Yeah,
right?
a lot of times you have a health plan, you cannot find a doctor anywhere near you.
Yeah,
or
network's very important.
You can't find a good doctor. That's like a challenge for a lot of people.
Benefits.
Yeah.
MetroPlus has 0 copays when you go to the specialist, 0 when you go to your lab work, your x-rays, all 0. There's no payroll deduction for city workers. So it's a very affordable plan with 0 premium costs. Big network, all those added value benefits I told you about, like the rewards program, the gym reimbursement, the 100 free drugs that we're giving out to people. It just goes on and on. It's a big value add.
Is that
for
a
people.
new thing, the drugs?
Yeah. So most health plans, you have to take the option rider as part of your benefit in order to get the drugs. We also have an option rider. It's a small biweekly pay out of someone's paycheck if you're a city worker. But we tell people, forget the option rider first. Look and see if one of those drugs you're taking is on our list of 100 free drugs. We did surveys. We know what the popular drugs people are taking, so we just added it for free. Contraceptives, antidepressants, blood pressure, cholesterol, the GLP-1s. Over 100 of them is on a list on our website that you can see, and you say, I don't even need to take the option rider. I'm going to get them for free from MetroPlus. So that is new for this year.
Wow.
Absolutely.
What if you have a drug that is not on the list?
Then you will need to take the option rider.
Got it.
But city employees have 13 different health plans they can choose from. We're one of them. But we're one that's only one of the 13 that's free. There's only 3 that's free, and we're one of them.
Got it.
If the drugs that you're taking are not on there, I'd advise you to take our option rider, which is like $62 a biweekly if you're single, $112 if you're a family, to get those other drugs that you may need.
Got it. But chances are, of the 100.
Yeah, we did a lot of surveying to understand what are the most common drugs.
Yeah.
And most city workers I talked to found out, oh, my drug is on there. So the base plan is free. They don't need the option rider because their drug is there.
Got it. What about open enrollment and dates and things like that and cutoffs? What should people know about that?
Good question. Open enrollment for a city employee started on November 1st and ends on November 30th. So I employ people to make sure that you don't just get settled on the plan that you've always had, because you may find that that's not the best value for you. But you do have to make that decision by November 30th. Just go on your city agency's portal. So, for example, if you work for Health and Hospital, we have a portal where Health and Hospital employees can go. If you work for NYPD, there's a different portal. So just go to your city agency's portal where you actually enroll or make switches, but you have to do it by the 30th.
Okay. So like today.
Yeah. It's very important.
So get on it today.
Get on it today.
Yeah.
Angie, like I said, a lot of city employees tend to say, well, I've been on the same plan year after year. I don't want to make any changes. But they're losing out on all these values, the network, the gym reimbursement, the 100 free drugs, the wellness apps, not having to pay for specialist visits or, lab work or x-ray. So we have a lot to offer.
You were talking about the city workers and the deals they get, but what if you're not? What if you're do something else or you're a freelancer?
Yeah, good question.
How does that affect you? Yeah.
So we have multiple programs for different people. If you are not eligible for Medicaid because your income is higher than the Medicaid allowable threshold, more likely you may be eligible for the essential plan, which is typical for somebody who's like a freelancer. So let's say you're a freelancer, you are able to get the essential plan with no cost to you. It's a zero plan. We offer a benefit called the Flex Card. So someone can get groceries and OTC benefit, over-the-counter drugs, for $112 a month we give you towards that benefit. So that's pretty impressive.
Yeah, I find that it's some of this stuff always gets so complicated for people that it scares them out of either switching a plan or understanding your resources or I don't know, how easy is it to get enrolled?
It's easy. MetroPlus has sales representatives that can help walk you through the process.
Yeah.
We're going to ask a few questions. What's your family size? Meaning, is it you are single? Do you have a spouse or you have children? We're going to ask you a little bit about your income in order to see if you're eligible for Medicaid, the essential plan, or the qualified health plan. We're going to ask you some questions around your status. Are you a citizen or are you an immigrant who just came to New York, so that we can know what documentation we need to supply in order for you to be eligible.
That might be scary for some immigrants to walk into the office.
It totally is. There is a lot of fear right now around whether or not, if I'm an immigrant, am I able to apply? Let us figure that out. There's a lot of different ways in which immigrants can qualify. We know all of the documents that are required. We can help you upload it to the state in order to make sure that you're eligible. And if not, MetroPlus is owned by the New York City Health and Hospital Corporation. So that's the city public hospital system. So if you are an immigrant and you haven't finished all the proper paperwork to be able to be eligible for a government-sponsored program, Health and Hospital has a fee scale program that you can get on. It's called H&H Options or NYC Cares. And that program will allow you to get coverage with minimal cost if you're an immigrant undocumented.
So what happens if somebody misses this period, this enrollment period? Is it over, or is there other opportunity?
There's opportunities. If you are eligible for Medicaid, the Essential Plan, it's every month. You can join at any time. There's no sort of open enrollment period. If you are already on, let's say, one of the qualified health plans, that's when you have to do it by December 31st. And if not, you will have to wait to the next open enrollment period. So let us come and screen you. We have to know what your income is, what your family size is. Did you already have a health insurance plan and you want to change health insurance plans? These are all the types of things that a trained representative can help decipher for anybody.
What about like vision or dental? Are those things covered? Or
Dental and vision is covered.
Yeah.
MetroPlus was fortunate to offer people another what we call added value product, where not only do they get the 10 essential plans that are part of the Affordable Care Act, Obamacare, we added on dental and vision as another rider for a few extra bucks.
Wow, that's amazing.
Yeah.
It must feel good to help people in this way, right? Like
it is.
Yeah.
And
I'm sure you see so many stories of people who come in, didn't even know they qualified, struggling, or sick.
MetroPlus has been here for New Yorkers through many different things. During the pandemic, we were one of the first plans to, after everybody kind of went underground and you couldn't really find anybody, MetroPlus got back out there right away. We made sure we did the right precautions. We put on our, mask and our gloves, and we went back out to the community to help people get insurance. And it was truly eye-opening to watch people struggle when there was a pandemic going on, trying to get the resources they need, like health insurance, et cetera.
Yeah.
We worked through the large influx of migrants that came to New York that was being shipped here from California and Texas. We were there. MetroPlus was there to embrace the migrants and make sure we assisted them with being able to get the resources they need, not just insurance. We put on a lot of different resource fairs where we brought different organizations together to help people get register for school, help them get a job, help them do the paperwork needed to become a citizen, etc. So MetroPlus has been in the community for a long time, which is why we open up community offices. We help people during the time where there was food insecurity, and that's still going on right now.
Yeah.
Everybody's feeling a pinch right now with SNAP benefits being taken away. MetroPlus is out there offering benefits for people who are losing their SNAP by giving out non-perishables at our community offices. We're doing different events with city agencies, with community-based organizations to make sure people who were getting SNAP benefits can still get the things that they need.
Thank God. Specific questions. Who is eligible for the Essential Plan, the Managed Medicaid Plan, and then the children? There's a child health fund too, right?
Yeah, sure. Yeah. So, for example, if you are a single individual and you earn under $16,000 a year, you'll be eligible for Medicaid. If you're earning over $16,000 a year, but somewhere around $36,000 a year, you'll be eligible for the Essential Plan. If you earn more than $36,000, then you have to go to Qualified Health Plan. And we have all of those products available. And that was a scenario for a single individual. If you are a family where there's more than just one person in the household, the dollar amounts increase. So you're able to earn a little bit more for those different programs. But I just gave you a single individual as an example.
Yeah. What about the Child Health Plus? What about
Child
that?
Plus is good.
Yeah.
Every kid is eligible for Child Plus regardless of immigration status or income. So, for example, if you're undocumented, all children can get Child Health Plus.
Wow.
Okay? There's no sort of cap on immigration related to Child Plus. But it also goes on family size and income. So let's just say I'm a family of 4 and I have, a spouse and 4 kids. I'm a family of 5, excuse me. You may have to pay $9 or $12 or $15 a month for a child to get on Child Plus. But if you're earning less than that, it'll be zero for you.
Got it. What about for seniors?
So MetroPlus offers 2 Medicare Advantage plans for seniors. This program is for people who are usually 65 and over, who have Medicare and Medicaid, or you could be 65 and over with Medicare by itself. In addition, if you are someone who gets Medicare because of a disability, meaning you're under age 65, but you have a disability that qualifies you for SSI, we have 2 Medicare programs for you.
Got it.
Medicare Advantage is a wonderful program in that there's a lot of supplemental and added value benefits that you don't get with traditional Medicare. So, for example, everyone talks about the famous OTC card, which seniors could take advantage of. OTC stands for over-the-counter drugs, over-the-counter types of items, Band-Aids, Tylenol, stuff like that.
Yeah.
MetroPlus offers a $525 per quarter OTC benefit That means that someone can take that OTC benefit, but it's also called a flex card, and use it not just for OTC benefits, because MetroPlus offered the flex version of it. They can use it to pay utility bills.
Wow.
They can use it to buy groceries. They can use it for bathroom safety items. They can mix and match. So that flex benefit allows people to mix and match these benefits. Sometimes you may want to put $150 towards your cell phone bill. You may want to take $200 and buy groceries, and the others you want to get the personal response system. I've fallen and I can't get up.
Yeah.
That button you press. We allow you $525 per quarter with this OTC flex benefit, and you can use it anytime in the quarter. Some other health plans, you have to use it month to month, meaning you get a certain value for the month. If you don't use it, you lose it. We allow people the flexibility to spend that money across a quarter. So you can save it all for 1 month or use it all in the first month. It's up to you.
Yeah.
So you get that flex benefit. That's very important for seniors.
Yeah, for sure.
Yeah. You get eyewear. We cover up to $500 in eyewear a year. We cover up to $500 in hearing aid services a year. There's just so many rich benefits that someone on Medicare can take advantage of as well. And that open enrollment period is going on now as well. There's a lot of open enrollment periods going on.
The moral of the story is the phone number pop up in one of the locations.
Yep.
And the website.
Go to the website, yeah.
Yeah.
And then you can find out more information.
Give them the information one more time.
Again, so if you want to talk to someone who could speak to you more about the open enrollment in person on the phone, call us at 1-855-809-4073. If you want to visit us in person and you want to figure out where can I find a MetroPlus representative, we have 10 community offices all throughout the 5 boroughs. If you need the address and the time and hours of operation, go to our website and it's listed there. If you just want to go on our website because you want to look at these benefits on your own, visit us at www.metroplus.org. And you can also find a representative on our website with their specific cell phone number, the languages that they speak. It's a personalized person that you may want to select from our virtual office on our website.
Beautiful. And I should also mention that it has MetroPlus has achieved a high quality rating and an overall 5-star rating in the New York State Consumer's Guide.
Angie,
just to give you a little confidence.
You know these benefits better than
when
me.
you shoot down there. I mean, we've done this a few times, Roger.
Listen, between network, which is very important, you have to have a big network, robust, a lot of providers.
Yeah.
You have to have good benefits, like I told you about, gym reimbursements, wellness apps,
Eyeglasses.
100 free drugs, eyeglasses, hearing aids. You also have to go with a plan that's highly rated for customer satisfaction and quality of care. The state reviews and audits health plans all the time. They survey members, not us. They survey members to find out how they're experiencing wait times, customer satisfaction, etc. So we've scored a very high, rating on all of our different products, whether it's Medicare, whether it's the Essential Plan or Medicaid Managed Care. The state reviews us, and we have very high star ratings. And you can see our star ratings on our website.
How many New Yorkers do you think are walking around with no insurance?
There's a lot of New Yorkers walking around no insurance right now. And what's about to happen, Angie, is that due to a lot of the federal changes that are happening right now, the Essential Plan has 5 different tiers to it. And it's all based on poverty level. So if somebody is between 200 and 250% of the federal poverty level, that's about to go away. These new changes coming down from the federal government mean that anybody who got on the Essential Plan, whose income falls between 200 and 250% of the federal poverty level, they won't be eligible anymore. So remember that single I was telling you about that can earn up to about $36,000?
Yeah.
If you earn $50,000 a year and you were able to get on it because of EP5, that's going away.
Wow.
MetroPlus is about to lose like 30,000 people.
Wow.
Because of this new federal change.
So if you enroll now, will that be taken away from you after the federal change?
The federal change is going to kick in June 30th of 2026. So let me backtrack.
Yeah.
Essential Plan 5 was created as a extension to the existing EP plan under the previous presidential office, right? It was an executive order that allowed those additional people to get insurance. The new administration said, no, we're going to reverse that executive order. We're ending it. So all those hundreds of thousands of people who was able to get insurance because of that executive order under the previous administration, that's going away June 30th. we are going to experience about 30,000, but across New York State, there's going to be hundreds of thousands of people who fit that EP5 category that will no longer be eligible. So they'd have to either go to QHP, where there's going to be a monthly premium, or they're going to go without insurance for a while.
Wow.
So imagine having to pay $0 for the essential plan, and now July 1st kicks in, you now have to get screened again, and your income makes you eligible to get QHP. But now you have to pay a monthly premium of $500 a month. That's going to be a big sticker shock for some people.
That is a huge sticker shock.
Another thing that's changing is before you used to be able to get subsidies from the federal government to pay for some of that monthly premium. That's going away too. So that started on November 1st. Mm-hmm. Anybody who was getting subsidies to help pay for their QHP plan, that doesn't exist anymore. You're on the hook for the full premium. So that's going to be a lot of money. So there's going to be a lot of people who's going to go without insurance right now.
Wow, I hate to hear that.
Yeah,
I hate to hear that.
It's getting bad.
Okay, so for now, what do people do?
Again, I would suggest that people reach out to MetroPlus. You can call us at 1-855-809-4073. I have people on standby ready to answer any questions that you may have about the Essential Plan, Child Plus, Medicaid Managed Care. We have 10 community offices all throughout New York. Go on our website, and those community offices are walk-in centers where people can go. I have representatives in all these centers that can help, educate you and screen you. You can go to our website and talk to someone through a virtual office that we have. You can find a rep who speaks your language, whether you speak Chinese, South Asian, Russian, Albanian, Spanish. We have representatives who speak all those different languages, so you can connect with them by going to our virtual office on our website. You can find information at www.metroplus.org. But come to us and let us help walk you through the timelines for all these different open enrollment periods, to determine your eligibility, to talk to you about some of the changes that's coming down from the federal government.
Amazing. And you can get all this information, all this beautiful information.
Absolutely.
All right, there you have it, guys. www.metroplus.org. Thank you so much, Roger.
Thank you, Angie. Thanks for having me.